Hello, how are you?
Fine, doctor, but please solve my problem.
What happened?
All tests of my wife and me are normal. Still, she is not able to conceive.
See, you must have done basic tests like semen analysis. Your wife must have undergone DNC, and they must have. I think you must have only checked the tubes. After that, if all these tests are normal, we can do an IUI for your wife. For 2 cycles, we have to do follicular monitoring and IUI. If she conceives by this, well and good. If not, then maybe we have to go a little further beyond that.
What is the next step to be done?
See, sometimes there are certain diseases which we cannot evaluate by doing these indirect tests. So we have to do a diagnostic laparoscopy and hysteroscopy. In this method, we just put a telescope and see everything inside the pelvis.
What are the benefits of doing laparoscopy or hysteroscopy?
The things which we cannot see otherwise, if we put a telescope, as I told you before, we are able to see many diseases which otherwise we cannot see, like tuberculosis. We will be able to see tubercles inside, endometriosis, which otherwise sometimes looks normal, but there is a problem, and we can find out couple of adhesions are there inside the pelvis. Tubes mobility is restricted because of that. So we just need to find out what is the reason why sometimes tube-ovarian relationship is not there, tube is lying somewhere else and egg is being released somewhere else, so the tube is not able to pick up. So these are the advantages of doing laparoscopy. We can find out what could be the problem that in spite of all the tests normal, your wife is not able to conceive. Another, if we do a hysteroscopy, we will be able to see how is the uterine cavity, because uterine cavity is very, very important for implantation. So if we come to know that there is some problem in uterine cavity, whether there are some adhesion, if there is any polyp inside, if there is any fibroid or tumor inside which is restricting and not allowing your wife to get pregnant, then we can solve it there and then. So the basic, which you call it everything is normal, becomes abnormal after some time, because when we do a hysteroscopy and laparoscopy, we come to know many more problems which otherwise could cause infertility.
What is IVF? See, is it done inside the body or outside?
See, in case the people who are not able to conceive after so many trials of IUI and laparoscopy, hysteroscopy, the next step is doing IVF and ICSI. Actually, IVF is a process in which we make many follicles, that means many houses of the egg inside the ovary. Rather, I'll say we stimulate the ovary and make many follicles. One fine day we aspirate all the follicles, take the sperm, husband's sperm, fertilize it outside the body, and then we put it inside. So the fertilization part is outside the body, and rest of the thing like putting the embryos back, picking up the eggs from the ovary is from the body.
Can I be sure that she will conceive after that IVF, ICSI?
No, I mean the success rate is going to improve, because sometimes there are certain reasons because of that your wife is not able to conceive. Maybe the fallopian tubes are not able to pick up the egg. Maybe there is some minor adhesions which are not letting the egg being cached by the tube. In these cases, when we pick up the egg directly from the ovary and fertilize them outside the body, we can see the fertilization, we can see the embryos form. Then we put it back into the uterus and chances of success are more.
Could there be any problem with my sperms?
Yes, of course. Sometimes, apparently the sperm look normal, but when we do a further testing, we find out that there is a problem, like quality analysis of the sample, in which we stain the sample and try to see how many of the sperms are normal. So that is one way. Another is DNA fragmentation, as we discussed before. In DNA fragmentation, we find out how many percentage of DNA fragmentation is there in a sample. So these are the tests which evaluate your fertility as on the sperms are concerned.
Is there any test I can undergo to find out about my sperms?
Basically, a test which I mentioned before, like DNA fragmentation test, some hormones, your body hormones, because of that maybe the motility and the count is low. or maybe the quality analysis, maybe some infection in the sperm, maybe we see some pus cells in the sperm. So these are all the tests which we need to, maybe semen culture, these are the tests which we need to know and know about the fertility part of the male.
What if sperm fragmentation test is abnormal?
See, basically when we find that sperm fragmentation test is abnormal, we would like you to change your lifestyle. First of all, you need more of oxygenation, like you go for exercises, you do lot of yoga if possible, do not smoke, do not drink, take less of stress, do some relaxation exercises. We would like to give you some antioxidant medicine also. After that, taking all this as a package, you can repeat your DNA fragmentation. If your DNA fragmentation becomes better, you can try the older methods which we were trying before. But in case if your DNA fragmentation doesn't improve, then your wife will have to undergo ICSI.
Will I have to take many cycles for the success?
We cannot say that. Sometimes success comes even just after one cycle. But even if you have to take second or third cycle, I don't think you should hesitate in doing that. Because what happens, always the success rate in second cycle is better than the first. Whatever patients are left and have not conceived in first cycle, they would be conceiving in second or maybe third. Only few percentage of people stay who do not conceive after 3 cycles. So in those cases, we have to evaluate further and find out what could be the reason. Is the body repulsing the pregnancy, or immunological test giving rise to some problem? So these are the things which we need to do later on.
Thank you, doctor. Thank you so much.
Thanks. All the best.